right, Doc, talk to me a little bit about testosterone therapy in men.
So testosterone therapy for men is something that's very misunderstood, and a lot of guys think it's complete taboo to even think about doing testosterone. The huge misconceptions are out there about, oh, testosterone, be careful with that because that's going to cause cancer, or that's going to give me some side effects that are unfounded. And it's basically bro science, and none of those things are really true. Some of the signs and symptoms that men will have is they're going to have a decreasing libido. They're not going to have their very poor sex drive. They're going to be fatigued. Some of the main symptoms that when they come into me is like, you know, Doc, I go to the gym and I sit there in the parking lot thinking about every reason not to go into the gym. So I don't have the energy to actually work out. And they're getting fatter, and they're increasing abdominal girth, they're losing lean muscle mass. Those can be the principal signs and symptoms of a decline of testosterone.
What would be the benefits, you think, of testosterone therapy?
First of all, from the weight perspective, increasing or optimizing your levels of testosterone will help you to increase lean muscle mass, and will also help you to then increase your resting metabolic rate and help you greatly to lose weight.
So what's the form of administration for testosterone therapy? How can someone actually start getting testosterone therapy?
Well, the routes of administration can be either from the insertion of pellets, which is basically putting in these pellets under the skin, and they dissolve slowly over time. However, the amount of pellet placement in a man is going to be a lot more than for a woman as far as the milligrams are concerned. The other route of administration is injectables, as most guys know. We're actually even moving towards more microdosing now, splitting your actual dose into 2 times a week, so that way you get a more even, steady state throughout the week. The other routes are going to be gels, which I'm not very fond of because you have to be protective that you can transmit the testosterone to people that you come in contact with, your wife, your children, so it's not one that I really like. And lastly is through a troche, which is placing under the tongue. And those are again not very ideal because we don't know exactly how the concentration is going to go in your blood.
You mentioned pellets, so I mean, does it hurt? How does that process work?
So the placement of pellets, the patient lies down on their stomach, especially for men. Women, they are on their side because you have to put them in the gluteal region on a woman. For a guy, he lays on his stomach. I sterilize the area. Typically, it's going to be in the love handle. I sterilize the area, and then I put the pellets under the skin. Usually, it's about 8 pellets total that are placed under the skin, and they're placed in a chevron type pattern. And again, there's no stitches required. It's just a sterile dressing is put over the area of the incision.
Dr. Alonso, what does someone have to do to get on testosterone therapy?
So the first thing he needs to do is come in and get a comprehensive blood work done. After we get the blood work, we'll call a patient in for a consultation. We'll go over all their blood work with them, and depending on where their levels are, is dependent on whether or not they need to get started on testosterone therapy. Each individual treatment is designed for that one individual person. It's not a cookie cutter type approach to this.
How fast does it take for them to start to notice a difference?
Okay, so typically some of the symptoms such as depression, fatigue, anxiety, those within a couple of weeks they're going to start to see a big difference. The other things such as weight loss are going to take a little bit of longer time. But again, overall, within about 2 months, they're going to start to see a significant change in their overall vitality and energy level.
Okay. Is it painful?
The most painful part, to be honest with you, is placing the anesthetic. After the area is numb, you don't feel a thing.
And what do we need to do to actually get started? What does it take to get started on testosterone therapy?
If you have any questions, you come in and we draw a comprehensive blood panel on you, and we see where all your levels are. And the goal of the treatment for both men and women is to give you enough testosterone or enough hormones to get rid of whatever symptoms you have. This is not one size fits all, or not everyone gets 100 milligrams or 200 to start with. It's about the individual person. After about 6 to 8 weeks, we redraw your blood work to make sure that we're in the right track, and we confirm with the actual symptoms of the patient. You know, we treat patients, we don't treat labs.
How long will will someone be on testosterone therapy?
So that's a big misconception also about treatment of testosterone. Testosterone treatment is not like if you have a pneumonia and I give you antibiotics, when the pneumonia is gone, you don't have to drink the antibiotics anymore. Testosterone is something your body makes naturally. The best you're going to do is what you're doing currently, however amount of testosterone your body's producing right now. So that, you can help yourself with some diet and exercise, but overall you need to get on hormone therapy, and you have to think that this is going to be forever, basically. The same way that you eat, drink, you have to consider this as part of what your body needs and overall to improve your overall vitality and energy. This is Dr. Alonso with Nuceria Health. We have 2 locations in South Miami and Doral. If you have any questions or you want to just come in for a free consultation, we're here to help.